Hi everyone, here at Paws and Claws again. Today we are actually doing heartworm treatments on dogs. We're actually doing the last of 3 injections. These dogs came from down south. There tends to be a much higher incidence of heartworm down south. And the treatment is pretty risky. We use an injection that actually kills the adult worms off, which are residing in the lung tissue. And so when you kill those worms, you got dead worms sliding in the lung tissue, you can have reactions sometimes. So it's a protocol that's been established by the companies that make the product. Today we're using Duraban. Duraban is a generic form of the product, and the injection is given on a protocol where it's given once, and then we wait a month, and then we do 2 injections 24 hours apart, so a total of 3 injections. And we today are on the last one, the 3rd injection. So they got their first injection yesterday. Second injection it would be technically yesterday, and we're going to do the 3rd last injection today. So we're going to do a temperature, make sure everything's stable. The injection can cause reactions, particularly local reactions too. And then I want to make sure we're not running a fever or anything like that. So we did have a couple dogs that are lethargic, painful from yesterday's injection. So we're going ahead and giving them a little bit of steroid today too for all these guys. And then the owners are going to start oral steroids at home. To help with any side effects a little bit. Looks like we're going to be normal. We're coming out about 101.2. Normal dog temperatures usually run higher than ours. So if you get a dog temperature of 101 to 102.5, it's actually still normal. So 101.2. And then we're just going to kind of take a listen. They're all coming in bright and alert. No respiratory distress. Gum colors have been pink, nice and pink. And then I'm going to listen to the lungs, make sure I'm not hearing any problems before I give this next injection. Just in case they were a dog that was having complications, we don't want to add to it. So we're just checking everything over before we do the injections. Heart sounds great. And the big thing is the lungs. Are the lungs clear? Do we hear any fluid? Would be like crackles or wheezes or anything. And they're sounding really good. Most of these dogs are going to be fine. They already had their 1 injection a month ago, and typically it's the first injection if you see problems. The protocol we're using now, where we give 1 injection and wait a month to do 2, is actually the protocol that was developed by the manufacturers and research for dogs that had advanced case heartworm. And now we've just switched it all over to every dog getting that treatment. In the old days, they would sometimes do 2 injections right away, and they started seeing some issues with that. So the Heartworm Society of the United States came out and said, you know, don't stage them, don't give them injections based on their stage, just go with the higher risk stage protocol, which is the 1, wait a month, and then 2 injections. So that's what we're doing today. Okay, so the first thing I'm going to do is give a steroid injection, and it's just a small amount. It's dexamethasone, and that I'm going to give IM2, which is in the muscle. You guys ready? Mm-hmm. And it can be a little painful, but not near as painful as the heartworm treatment injection. The heartworm treatment injection has to be given very deep in the muscle. If it gets into the sub-Q space, it can cause reactions. And even when you do it deep in the muscle, they sometimes get a lump here the next day or so, and they're almost always really tender here, so for a day or 2. But that injection has to go deep. And we try to give it in the lumbar muscle. So the spine's right here where my finger is. Yesterday they did it on the left side. Today I'm going to do it on the right side. Okay? And then we hold off after we give the injection. So you can see this needle's pretty long. And we go all the way in, withdraw to make sure I don't have any blood. And then I give the injection. And then we're going to put pressure over the site right there and hold off for 2 minutes at least. So that we don't get any backflow of the product up into the skin or anything. So, and that's it. And then we monitor them really close. Typically, if a dog's going to have a reaction, it's usually within the first 30 minutes to 2 hours that we're going to see acute reactions. Long term, definitely over the next 24 to 40 hours, they can be tender, painful. Sometimes they don't want to eat very well. So it is not a cut and dry treatment. There's this risk involved. So this is why you want your dog on monthly heartworm preventative. The monthly preventative kills the immature larva the day you give it. By killing the baby immature larva, they never have a chance to develop into the adult worms that cause all these problems. So that's why we recommend monthly heartworm preventative. And there you go.